Now, one of the things that we often hear about salt is that you definitely need to have a good intake of it if you're exercising or if you're in a hot country, because you lose it in the sweat through the skin. Now, there's been some very interesting studies done over this through the years. And if you think about, the look of sweat on a garment, if there is a lot of salt consumed, then the sweat will leave a white mark in the garment. And this is where a lot of salt is being excreted through the skin. So do we really need that salt? Does the body have to excrete it? Now, in 1949, in Michigan Medical School, they studied men working in very hot conditions. And both the kidneys and your skin have sodium conserving mechanisms, so they're able to retain sodium if needed. Now, what they did was they put the men onto a low sodium chloride diet, so low salt, and they actually perspired, on average, 40 milligrams of sodium in every 1 litre of sweat. Then they were excreting about 20 milligrams of sodium in the urine daily. However, on a typical American diet, which is classically quite salty, they were losing 1,000 milligrams, a gram of sodium through 1 litre of sweat, and 4 grams, that's 4,000 milligrams of sodium, being excreted via the urine. Now, one thing to remember, which I feel is really important, is that it's sweat. The most important ingredient sweat requires is water. Now, near the equator, where they have very low sodium diets, hypertension, that is, tendency towards high blood pressure, is very rare, and they equally consume very little salt in some of these countries. So there's a bit of a myth going on there. It's our body's ability to conserve it. And from the perspective of exercise, I'm going to have a closer look at that in the next slide. So just taking a look at exercise, and the things we need to consider are how much is the individual sweating? What is the quantity of sweat they produce? And it might be that someone who is on a high salt diet will sweat more than someone who's actually on a low sodium diet. Looking at how long of a period of exercise that we're taking, and also looking at the temperature of the room that we're exercising in, or the external temperature of the day that we're exercising on, because all of those factors will have an effect on the amount of sweat that we're producing. Now, the Chinese regard the skin as a really important and huge route of elimination. They call it a third lung or a third kidney because it is such an important route of elimination. A way in which we can excrete waste from the body. And so just looking at this study I've got here, which is about 70 years younger than the one on the previous page. It's very recent, and it looked at the effects of a high salt diet and our immune system activity. And what they found was that a high salt diet, high sodium chloride, would increase the activity of some immune cells and decrease the cell activity of others, which had a detrimental effect in terms of conditions like eczema, arthritis, and other allergies similar to eczema. And so it's thinking about as well the fact that they found higher levels of sodium in the skin of eczema patients as compared to patients that had healthy skin, or patients in the study that had healthy skin. And so this is also known as atopic dermatitis. And what I would like you to think about in terms of naturopathically thinking about the skin is what we call a sodium discharge through the skin, which can cause the itchiness that is associated with a rash, and also the rash itself, the heat and anger in a rash. And if that's something that you'd like help with, then please get in touch.